Bismillahirrahmanirrahim. Assalamu alaikum. Dr.S.M.Zafeer with you, and you are watching my informative vlog on Facebook and YouTube channel. Are you worried about frequent colds in your children? This video is especially for the anxious parents. Are you ready? Here we go. First of all, let me tell you that if your child gets frequent colds, that means every on and off, it is not a sign of weak immune system. It just means he is exposed to many viruses. The only reason to have a child's immune system tested if the colds often lead to more serious infections like pneumonia. Colds are called upper respiratory tract infections. Young children get a lot of colds because they haven't had a chance to build up immunity to the many viruses that cause colds. As your child gets older and older, they will gradually build up immunity and get fewer colds. There are many things that can cause your child's nose to constantly be running. From common issues such as colds and flu, sinus infections, allergic or non-allergic rhinitis, or structural issues including enlarged turbinates or enlarged adenoids, congenital septal deviations, or corneal atresia. Cough caused by colds due to viruses can last weeks, especially if a child has one cold right after another. Asthma, allergies, or a chronic infection in the sinuses or airways also might cause lasting coughs. If a child still has a cough after 3 weeks, call your doctor. You must be interested to know that how many colds are normal for kids. Most children will develop at least 6 to 10 colds in a year. This number increases for children who attend daycare. Colds do not happen as much after the age of 6 years. That means 1 to 5 years they are having more frequent colds every month or so. So that is the normal variation. Adolescents and adults get colds about 2 to 4 times a year. It's very normal for kids to contract cough and colds every month as their immune system built up. Sometimes parents are very concerned about their child's immune system. Let me tell you in short about the signs and symptoms of primary immunodeficiency. If your child is having frequent and recurrent pneumonia, bronchitis, sinus infections, ear infections, meningitis, skin infections, inflammation and infection of internal organs, blood disorders such as low platelet count or anemia. Now your next question is, how can I prevent my child from getting so many colds? Well, here are some tips that work to keep your child healthy. Number 1, hand washing. Many illnesses are spread through germs shared by touch. Number 2, routine immunization, including yearly flu shot. Number 3, cover coughs and sneeze. Nutrition and supplements, including green vegetables, fruits, especially citrus fruits. Good sleep boosts up immunity. Regular exercise. Parents should avoid tobacco. Children who are exposed to passive smoking are frequent having upper respiratory tract infections. Some children are sensitive to pets, so you have to decide whether to put pets or no. Good vitamin D status in kids actually prevents cold and flu. For kids who have a low vitamin D status, they are much more susceptible to colds and the flu. It's not likely that kids get enough vitamin D through food. Breastfeeding babies definitely need a vitamin D supplement. The fruit juice which is good for cold, number 1, orange, grapefruit, other citrus, green apple, carrot, beet, ginger, tomato, kale, celery, strawberry, kiwi, mango, watermelon. Now, citrus fruit, as we know that citrus fruit boosts up immunity. That's because it helps build up your immune system. Vitamin C is thought to increase the production of white blood cells, which are key to fighting infections. Almost all citrus fruits are high in vitamin C. Some children get a stuffy nose at night because of change of humidity. Children and infants have narrower nasal passage than adults, making them more susceptible to nighttime congestion caused by inflammation or excessive mucus. Normal saline nasal spray is quite effective in clearing the nasal passage. If your young toddler and preschool aged child has runny nose daily or most days and they are playing, eating, running around, going to daycare and sleeping well, then it's very unlikely that they have a major illness. Now, your other question, when should I take my child to the doctor for a cold? Here are some signs that it is time to take your child to the doctor. Your child has been experiencing cold symptoms for more than 10-14 days. The child is having fever. For babies under 3 months of age, a fever of 100.4 degrees or higher is cause for concern. Now, call your doctor if your child is having fever more than 3 days, dull and sick looking, not eating well, vomiting, breathing fast and has fever, barking cough more than 3 weeks. So in this situation, you just call your doctor and take his advice. Now, take home message today is, number 1, common colds are common. Colds and upper respiratory tract infections are mostly due to virus infections. Number 3, avoid using antibiotic. Number 4, 6 to 10 colds in a year is acceptable. Number 5, steam inhalation, nasal decongestants, sometimes antihistamine, paracetamol, Tylenol, and good hydration. That's all. Thank you. Stay blessed.